Hi guys, good evening. It's me again, Dr. Jenny, physical therapist and Dr. Physical Therapy, creator and founder of Balance and Pulse Support Group in Aging Adults, and the vice chair of Global Health in Aging Adults, especially in Thirst Group. So every Thursday, we highlights innovator, we highlights entrepreneur, and also academician. And we even have audiologists before, and we even have different therapists from Canada. But for tonight, for the first time, we will have a clinical hypnosis. We will learn more. What is it? A clinical psychologist, guys. So it's very seldom for us to learn, especially we are majority therapists, and also our clientels are more on improving the balance and the falls, right? And your wellness and lifestyle. But tonight, we will learn more about how to improve our wellness, our lifestyle, and pain management. All right. So let's get to know more. We have Dr. Ali Navidi. He is a clinical psychologist, and we will learn more about him for tonight. All right. Dr. Ali, welcome to Balance and Pulse.
Oh, thank you, Dr. Jenny. It's lovely to be here, and I appreciate having this opportunity to talk to your audience. And mainly, I'm excited because it's a sad situation that hypnosis has been confused with so many different entertainment and movies and silly shows. And the clinical hypnosis, not many people know about. And it's a very useful tool that I'd love to explain more about.
Yeah, and I thank Dr. Jen Ushel for connecting me to you when she said, Jenny, do you want to learn more about pain management, but more on clinical hypnosis? Oh, sure, of course. And then I'm so glad that we're able to connect tonight. So when we say clinical hypnosis, so I know already that hypnosis is being used clinically for some clinical, let's say, cases. And what are those cases also? But explain more about what is hypnotism or what is hypnosis. Are they the same, Dr. Ali? Hypnotism and hypnosis?
Yeah, so hypnotism is more of an old-fashioned term, is used kind of back in the olden days. And I think it is more associated with the entertainment side of things. People who went around and did these shows, people, you might have even seen it, they might have come to your high school or college, and they do these shows. Hypnosis and clinical hypnosis is very interesting because it's been studied very, very thoroughly for many years. I'm talking about close to 40 years at this point. And there's two areas that I focus on. So I would talk more about these two areas. And those are chronic pain. So as a tool to help patients that are in pain, it is wonderful. And there's many, I mean, I'm talking 30 years, many studies done. There's meta-analysis. There's no doubt in the scientific community, this is a tool that can help patients. The other area that's been studied a lot is with gut disorders. And this is not an area people think of, but the most common gut disorder that we're talking about is irritable bowel syndrome. There's been a tremendous, like over 100 studies have been done showing that clinical hypnosis is very helpful for patients with IBS or irritable bowel syndrome. But the patients don't know about it. And there are very few people that are trained to do the work to help these patients. And that's why I started my clinic. It's called GI Psychology. You can find the information. It's just gipsychology.com. And we are available in over 30 states for telehealth. Yeah.
Okay, telehealth, that's easy access, right? So that's really good
Yeah.
because they just need to talk to you and do the session right there and then. So when you
Yeah.
say clinical hypnosis and majority of your cases is pain management and gut disorder, but what
Yeah.
is not clinical hypnosis? So what is it that is not?
Yeah.
You don't want
Yeah,
to.
we know, we like, if we assume it's not entertainment hypnosis, it's not the mind control and the magic and the all that weird stuff. It's actually very, very simple. It's just teaching patients to go into a trance state on purpose rather than accidentally. And a trance state is something we all go in and out of, you know. If I'm daydreaming, I go into a trance and then I snap back and oh, you know, what did I miss? If I'm driving to work the same way every day, you know, listening to my music, and then suddenly I'm there. Um, if we're watching a movie that we really get into or reading a book and we just lose track of time, these are all examples of trance that everyone goes in and out of trance throughout our day. And hypnosis is just teaching people to go into that state on purpose. And once they're in that state, they can learn how to do some very cool things like reduce their pain or help their brain and their gut get along with each other better so that they have less GI symptoms. Um, it's a wonderful tool for anyone to learn. And it's really about empowering the person. So Dr. Jenny, for example, if I were to teach you how to use hypnosis, you would be in charge. I'm just the coach. And I just give you a suggestion. Okay, why don't you think about this? Or why don't you think about that? But you're in charge of whether you want to think about that or not. And the goal would be to teach you how to do it yourself. Because I'm not going to be there when you need it. So it's about teaching you self-hypnosis to help you with your problems. Does that make sense?
Yes, yes. I'm getting a better picture now. Yeah, so you're just when you say trance, it's trans, trans state. Is it the
Oh, like
one?
TRANCE.
Oh, trans. So see, it's really different words. So the
Yeah.
trans, what is the trans itself means? Because I know it's the same.
It's like, so we have these different states of consciousness. You know, we have sleep, and then we have this alert state.
Okay.
Um, and then there's something called trance where let's say I'm listening to a lecture. And
Mm-hmm.
then suddenly my mind kind of goes off and I'm thinking about something that happened earlier that day. And then I come back to the lecture and I didn't hear anything that they were saying.
Okay.
Right. That was a trance. I
Okay.
went into my mind, I got lost for a little bit, and then I popped back. And
Mhm.
this happens, you know, I'm sure you can recognize
Yes.
that for yourself too.
We have really good term for that, like especially the people not listening and you're not really present on that state. Let's say the mother keep talking and talking and
Yeah.
talking and they're not focusing on that, and then they will say, huh, are you talking to me? And then they will
What?
ask you again, what did you just say? And we have a term that in Tagalog or in Filipino, like daydreaming, like
Yeah.
something exactly. So now it's closer to that because you're thinking of something, but it's not really the exact state. And then, but that's also a nice place for you to be there. You know, that's why it's a dream, daydreaming. And it
Yeah.
is not nighttime for you to dream. That's why we just call it that way. And exactly how you have
Daydream.
that, you're not on that particular state to focus on a lecture or something, like listening to your
Hmm.
boss and then you're thinking of other stuff. Yeah. So that's a good
Yeah.
definition. So that's a different test. So it's a trance. Now I know a scientific name for daydreaming, close to daydreaming.
Yes. Yes. You
That's
go
nice.
into this trance, and all
Mm-hmm.
cultures have different words for it
Okay.
because
Okay.
all humans go into trance, go in and out of
Okay.
trance.
Yes, yes. We
And
always feel that.
and but most people don't learn how to do it on purpose. They
Mm-hmm.
don't learn how to control it.
Mm-hmm.
And And at the very least, it's a very pleasant place to be mentally. If you've ever been in, you've probably noticed when you go into trance, it's very relaxing. It's very
That's
nice.
true. Yeah. And you need also something, a volume like to use in between to make it at ease, like music, like I'm sure, and like they do a relaxing music. I think I imagining when you do that in the psychology, because I watch these movies, and then they are police, because it's always like 911. I love to watch these movies, and then this particular police, when they have issues, they will have this psychologist, and they have a nice place, and they will just do like,
Yeah.
okay, think of
Yeah.
a nice place. Just what do you think? Just to calm them. And then they will go
Yes.
in that state. So I think I'm getting better picture.
That reminds me of oh, what's this show? My son has been watching a lot of this show, Criminal Minds, and they actually use some hypnosis in that show. They call it, I think, a cognitive interview. Basically, they do it when there's a witness and they want that to help the witness remember more details of what happened. And that is a use for hypnosis. That's not something I do because I don't work with crimes and I don't work with police. But there are some psychologists that do that. They help the police by using hypnosis to help the witnesses remember details that they've forgotten.
I think I know. I watch also. I used to watch Criminal Minds many times, but I still
Yeah.
remember exactly how they do that. Like, can you remember exactly the smell, the taste, and then
Yes.
like
Yes.
and then can you hear? Just imagine, and then they track exactly how the house looks like, and then they, yeah, that's really good. Yeah.
Yeah.
So, how does it work with pain management, Dr. Ali?
Yeah. So what we find is that there are stages of hypnosis. So the very first stage is education. We want to spend some time educating the patient so they understand what clinical hypnosis is and what it's not, right? It's not the mind control. It's not the magic. So then we educate, and then there's a phase that is called an induction. And that is the transition between normal state that we're in right now, right? Talking to each other, and that trance state where they're more like focused internally. They start to relax. They start to, the rest of the world kind of fades away. And that's the induction. And then there's a deepening stage where you help them get more and more into their inner mind. And then once you've done the deepening, then you teach them a particular skill. So as an example, you can introduce people to what I call the control room, where they can go into their mind and lower the discomfort or lower the pain. And I'd say a large percentage of patients are able to do that. Just being able to, let's say their pain's at a 7, going into this control room and going down to a 3. And then, so then after you do the intervention, right, then you do re-alerting and you bring them back into the normal state of consciousness.
That's a good like runway of the stages for that. I keep writing all those terms because you have the normal state, the trance state, deepening stage, then is the control room really part of the stage, or just a
No,
term for
it's,
the
you could think of
control?
it after the deepening, there's the intervention stage. So
Okay.
that's where you do something helpful for the patient.
Okay.
And I use the control room as an example of
Yes, yes.
one technique.
Yeah, that's why I want to ask first, because I imagine that the what's the last stage? The reservation. Did you say
Is
reservation?
the re-alerting.
Ah,
So bring
re-alerting.
them back to that more alert
Okay.
um, state of
I
consciousness.
can
Yeah.
understand my handwriting, the last part. Okay. So let's say we have many cases of pain case, like
Yes.
especially I just had it like now. He has low back surgery. All right. And
Yes.
receiver. So as a physical therapist, we have many cases post-op surgery from orthopedic cases and chronic pain. What do you think, knowing that this exists, just like simple things that maybe can help us, basic things that you can share that can
Yeah.
help us to do something for our patients prior to our activity? Because what I'm doing is that sometimes I just tell them, like, it's more on mind setting, right? Just think of, I heard that many times, just think of a beautiful place, like think of a positive things. Don't,
Yeah.
and then deep breathing exercises. But I know that somatic
Yeah.
energy and everything, the more relaxed you are, and then the body will be relaxed, and then the less some hormones and everything. But I know the brain tells the body what to do. That's how it's working here. But as a therapist, what you can suggest to us, Dr. Ali, so we can adapt
Yeah. So
something?
so I would say there's two areas to look at. One is in terms of your work as a physical therapist. Um, I would be very aware of the language you use with patients, right? Because you are an authority to them, and what you say to them, they're going to take into their heart, right? And a lot of training in hypnosis is about understanding how to use language. So as an example, the more you can build in your patient a sense of safety, that their body is working the way it should, that it's healing correctly, that they're moving towards health, you know, positive language versus negative language. Negative language would be your injury, your pain, there's damage, right? The more you emphasize that negative language, the more your patient will be thinking about it. Because, and this is maybe getting too deep into it, but the brain can't think of a negative. And so what I mean is, if I say to you, don't think of a pink elephant, what happens?
Yeah, I heard that pink elephant. So can you tell us, don't think of the pink elephant. So how they react? So what is that pink elephant
That pink
phenomenon?
elephant,
Mhm.
so if you've got
Even
someone
there's
who's
a book.
recovering, yeah, if you've got someone who's recovering from surgery and you're saying to them, okay, don't worry about your pain, just, keep walking or keep doing this exercise. You just you just made them think of the pink elephant. You said, don't worry about your pain. Immediately they're going to be thinking of their pain.
Yes, yes.
But if you say to them, okay, I want you to focus on your balance, focus on the way that your muscles are moving, notice, any muscles that are feeling comfortable. You've given them positive things to think about. And so that's what I mean when I say focus on your language. Is
Yes.
it positive language or is it negative language?
How can I rephrase my pain? What can will be, because I use discomfort just to lessen the pain. Do you have any
Sure,
comfort right now? But let's say, because we need to ask the pain scale, and that's also a
sure.
negative from us, like the first thing, how are you, Mr. Smith, do you have any pain? And they don't have any
Right.
pain, but because I asked, now they need to feel, do I have pain?
Now they're noticing it, right?
I need to, okay, Jenny just asked if I have pain, but I'm watching TV the whole time and I don't even
You
remember
don't
I have
notice
pain. But
anything,
now Jenny is here. She reminded me,
right?
and that's
And
exactly, how can we deal that? How can we rephrase the word pain, knowing that
yeah,
help?
and that's it's a very interesting subject that you're talking about because of course we do need to talk about pain. We
Mm-hmm.
can't
Yeah.
ignore the fact that there is pain. Um, and at the same time, how can we phrase it in a way that's going to be positive and healing?
Mm-hmm.
And so one thing you can even point out to your patient is you say, oh, how's it going? Oh, like, how's your day? How you feeling? these are all just neutral terms. And then you can say, okay, tell me about your pain. And then immediately what they're going to do is they're going to focus in on pain, and it's going to become much bigger in their mind. And that's when you can point out to them, isn't it interesting how you were feeling okay, and then when I had you pay attention to your pain, it suddenly became a much bigger thing in your mind. And that tells you something about how our mind works. When we focus on something, it becomes amplified. In psychology, we call that visceral hypersensitivity.
Yes.
And you've probably heard of that term too.
Yeah, from that somatic things and psychosomatic, the visceral, and then yes, I heard that.
Yes.
So that's how
It's the brain's ability to amplify the signals.
that's really interesting. That's true. And then that's why some people have less pain when they are not focusing in that. And that's the clinical hypnosis
Yeah.
come in, because you
Yeah.
want them to be on the trance state purposely, like as what you've said. Oh,
And you
that's
can even teach another technique, is the power of changing your focus. When people learn clinical hypnosis, it gives them a tool where they can shift their focus very powerfully away from the pain to something more positive.
It's
And
really
that's another technique to
interesting.
use.
Yes. That's really interesting because this is really important for us. Pain is another vital signs indicator. And this is the one of the most things that make them really depressed, and it's chronic already, and that limits their function. So that's really good to learn that clinical hypnosis is in the picture, that we need to learn more and also use. So how do
Yeah.
you have your training, Dr. Ali? Is it because of the psychology, or you have uh practiced the hypnosis itself as your masters or something?
Yeah, so it was actually hypnosis that drew me to learning psychology. Um, I was actually in the field of biotechnology. I had a degree in microbiology, um, but I was spending all my time reading about psychology and hypnosis and all these really fascinating things. And luckily, my wife is much smarter than me. And, she recognized, hey, maybe you should do this for a living. And so I changed. And so I've been doing it now for in my own practice for about 12 years. And then we've started this other practice over the last 3 years, because I found there weren't enough people like me who are trained to help patients with pain and with GI problems. Um, and so I decided I was going to train more people. So I started the clinic, and that's what I do in the clinic. I train the therapists who come in.
Oh, so the therapist. Yeah, you say something about the GI, knowing that clinical hypnosis has two main functions that you're using, pain
Yeah.
management and also for the GI. And your clinic and your practice is more on for GI disorders.
Well, really,
Yeah.
really, we do both. Really, we
Okay,
do both.
yes. In the clinic.
But the name of the practice emphasizes more the GI part of it,
Yes.
the stuff. But we do both in the practice.
Okay. Yeah. Can you tell us more a little bit about how does it helps the IBS, the GI cases? Like in a short,
Yeah,
so at least we learn more. Oh, right now Dr. Ali is doing this way, and we can tell to our people and our relatives to connect with you, because
yeah,
that's really disturbing. Imagine any occasion they try to cancel, they will not join.
yes,
If
yeah,
they will come, they will just check where's the bathroom. I saw that in the commercial. That's what they're in that particular medicine. And she will
yeah,
just, the commercial will say, where's the bathroom? In the picnic, they will look for the bathroom. In the camping, they
yeah,
will just don't go. So how does
yeah,
it work, Doc?
yeah. So the first thing to understand to all these patients out there is you do not have to live with this problem. They're told that oh, we've done all the scans and the scoping, and we can't find anything wrong with you, so I guess you're just going to have to live with it. And these patients are just so miserable. I talked to a lady earlier today. She literally has to cut out almost all the food she likes in the world because they cause her problems. And she has a very treatable problem. So how is it treatable by someone like me? I'll try to do it quickly. So there's two main areas that we can help with. And so the brain is talking to the gut all the time. They have a very powerful connection. And so when patients start to do something called hypervigilance, that means they're very anxiously paying attention to their gut. And what that does is it sends stress into the gut, causing more gut problems, causing cramping or diarrhea or pain. And then the gut sends these signals back up to the brain, and then the brain amplifies them with something called visceral hypersensitivity. That means it's taking signals that are benign, they're not signals showing a problem, but because the brain has developed this visceral hypersensitivity, those signals become pain. Those signals become discomfort. And then that causes more hypervigilance, which sends more stress into the gut. And it cycles and it cycles. Yeah.
Totally agree with that because anxiety, it hits more. So the more like they're anxious, everything will be like hyper. So now I understand the hypersensitivity, the hypervigilance, all the
Yeah.
hormones are acting up. So now the pain will be more worse. So that's really
Yeah.
good. Now your goal for hypnosis, clinical hypnosis is just to lessen the sensitivity or make
Yeah.
you calm
Two
and
things.
relax. Mm-hmm.
We're helping people to shift their mindset
Mm-hmm.
so that they
Yeah.
can, like you said, kind of be more relaxed, be more calm. But then we're also changing that hypersensitivity and turning it down so that it becomes normal. Their brain is is paying attention to the signals in a normal way, that they're not amplifying them anymore.
That's good. I have already a patient in mind. It's in the family.
Yeah.
You talk, we talk about we talk
So many
about
people have these problems. There's
yeah.
so I anyone I talk to, they're like, "Oh, I know somebody already who
Yes.
needs help." Yeah,
Mm-hmm. Then because of that, it's acting up in stress. It's just make it worse for them. Yeah. So definitely. So how can we connect with you, Dr. Ali? This is really interesting, and I'm sure many people are listening that was unaware that that's really exactly what's happening to them, and they thought it's just medication or maybe no medications at all. So how can
yeah,
we connect with you? We know you're in Virginia. You said you're able to be in telehealth. So that's awesome.
yeah,
So
yeah.
let's learn more. Go ahead, Dr. Ali.
So, so we're at gipsychology.com. Very simple. And we're in telehealth in over 30 something states.
Mm-hmm.
And everybody in the clinic is trained to help with the GI problems and the chronic pain. And my main message out there is for those people out there who are suffering,
Mm-hmm.
there are techniques, there are methods that have been proven to help, no doubt. In fact, the American College of Gastroenterology, the
Mm-hmm.
official body that governs all the gastroenterologists
Mm-hmm.
across the country, has put clinical hypnosis as one of their first line recommended treatments for
Wow.
IBS.
Why?
Patients need to know this.
Yeah, the gastroenterologist here didn't even recommend like that clinical hypnosis. So that's
Yeah,
really, see, it's
because
really good to know.
people aren't trained. There aren't enough therapists like myself who are trained to do it.
Mm-hmm.
So they don't even bother telling people about it. And that's the problem we're trying to solve. I'm trying to make this treatment available to people.
That's wonderful. Even for us therapists, do you have like training or course that we need to learn from you? Your coaching, do you do that?
Well, I haven't started externally doing too much training.
Okay.
I do a training though. It's kind of like brain gut 101. And then I also am going to be talking. Are you familiar? Jen's a part of this organization also. It's Evidence in Motion.
Yes, yes, yes. We have many clinicians, and I spoke with Dr. Who's the previous CEO of Evidence in Motion. Yes. Do you have
Oh,
class there?
Adrian Lowe.
Dr. Lowe is a pain, more on the pain, but I haven't speak with him. He's the CEO itself, Dr. John Childs. Yeah.
Okay, I haven't met them, but I'm going to be talking at their Align
Oh,
conference.
yes. Yes, yes. I'm
Yeah.
aware of that.
So I'll be giving a talk there. And just reach out to me.
Yes.
Any physical therapist that wants to learn more, just contact me. My email is just Navidi at gipsychology.com. So it's ANAVIDI at gipsychology.com. Reach out to me. I'm always trying to get the word out. I'm happy to meet with anyone who reaches out to me.
Yes, thank you so much. And we will be inviting you as well with the Geriatric Rehab Summit. Jen also was one of our speaker, but definitely we will connect with you so you can share us also this great topic in the future. Yes, so that's really good. Yes. And then we will also check with all those people with IBS and chronic pain to connect with you. When you say telehealth, is it like out of pocket or insurance can be covered? How does it work, Doc?
Yeah, so it's what's called out of network. So the patient pays up front, but then their insurance, they can submit to their insurance for reimbursement.
Nice, nice. All right, that's good to know.
And it's a short-term therapy, meaning it's usually no more than 10 sessions about.
Okay.
Yeah.
That's good. So that's really they can share all their they need to have an outlet, so that's good to know that they will be able to talk with you and share and they learn the techniques. So I know this will be a long topic and more, but thank you so much for all these nuggets. These are all new to us and some are very familiar on what's going on. And I am happy that we're giving hope that this is a positive way to learn that there's a way to improve their IBS symptoms or lifestyle, especially for our patients having a chronic pain, things like that. Thank you so much, Dr. Ali, for sharing your knowledge to us. That's really, really very interesting topic. So guys, if you have any question, Dr. Ali's here, our first clinical psychologist. And then we learned a lot from him. And now that's really lots of cases we encounter. Imagine therapists are pain. We always encounter pain with our clients, and now there's another way to help them by learning more about clinical hypnosis, that this is existing, and Dr. Ali can share his knowledge to our patients. Just imagine via telehealth. And thank you so much. If you want to learn more, connect with us. I will going to put his email and information so they can connect with him. Dr. Ali, appreciate you so much. And thank you for your time. Thank you, guys. And I will connect with you again. All right. It's me again, Dr. Jenny from Fishy-Gen and Balance and Fall Support Group. Appreciate you guys. And if you have any questions, connect with us. And thank you again. Have a great day, guys. Bye for now. Thank you, Dr.